Hello, my name is Aaron Vissman. I am an assistant professor in the Department of Health Sciences at Thomas More University. I'm a public health scientist generally working in community mental health, disease prevention, and behavioral health care industries for the past 8 years. I'm skilled in longitudinal multi-level intervention research, most notably several HIV prevention interventions in North Carolina and Georgia, and also interventions to improve fentanyl detoxification outcomes and reduce opioid overdose deaths in Greater Cincinnati. I'd like to introduce myself so you can understand my background, what courses I currently teach, and some of the different ways that we may work together. So I was born in Covington, Kentucky, and went to high school at St. Henry, and then moved to Lexington for college, where I studied philosophy and psychology. I was interested in wards of the state when I was graduating, and went on to work in children's residential treatment facilities and runaway shelters for about 3 years in California. In Southern California, I enrolled in a dual degree program for social work and public health at San Diego State University. However, after the second year of my public health, I enrolled in my public health internship, and I was studying CDC efforts to prevent HIV/AIDS and multi-drug resistant tuberculosis in Bangkok, and that helped me decide to drop out of the social work portion of my program. And really, I've been doing applied epidemiology and designing and implementing prevention interventions ever since. So I left California for North Carolina and joined a research team at Wake Forest University for 4 years. And after that, I moved to Atlanta for my PhD program. As a PhD student, I learned about latent variable modeling, statistical models, and taught survey research methods in behavioral sciences for MPH students. I received a 2-year pre-doctoral scholarship from the National Institute of Mental Health to support my dissertation research. And after a few years back in Cincinnati, I also completed another 3-year postdoctoral training on occupational stress, and that was supported by the National Institute of Occupational Safety and Health. So I had a really great mentor named Scott Rhodes in North Carolina, and together we developed at least 4 different HIV, AIDS, and cancer prevention interventions that were tailored for the rapidly growing immigrant Latino populations living in North Carolina and the southeastern United States more broadly. We also developed chat room-based interventions to improve sexual health information and communication online. We developed other community-based participatory research projects that investigated impacts of immigration and customs enforcement policies on policing and immigrant health behavior. After completing my PhD and moving home from Atlanta, I had to develop a new research team. And our current research projects focus on more workforce development efforts in halfway houses and residential addiction treatment facilities. I've been developing and testing a new intervention known as peer ops, which aims to change behavior of bystanders, reduce viral hepatitis, and reduce opioid overdose mortality rates in justice-involved populations in Greater Cincinnati and throughout Ohio. My teaching and research interests fall within the areas of public health, behavioral sciences, and workforce development with the goals of traumatic injury prevention and infectious disease prevention. Presently, I'm teaching 2 sections of global health and developing student opportunities for applied practice experience. I really look forward to meeting you and learning about your interests and your ideas for improving the public's health.